Okay, good morning, everyone. A little bit more energy. Good morning, everyone. Awesome, awesome. So thank you for that introduction. I really love hearing other people talk about me, obviously. And it's an honor to be here today. I want to thank Dr. Selina, Dr. Vivek for inviting me to open the meeting today after the amazing Dr. Jamila. I don't know how I can beat that actually, but I love her message about doing what you love, because that is also going to be one of my main messages today. So I'm Azhar Ahmad. I'm the head of medicine for Boehringer Ingelheim in Malaysia and Singapore. So if you haven't heard of Boehringer Ingelheim, we're actually one of the top 20 pharma companies in the world. We're a German company owned by a family called Boehringer, and the headquarters is in a village called Ingelheim. Therefore, Boehringer Ingelheim, very easy to remember. So I've been working with BI now 11 years, and my aim today is to inspire you that actually you can still have a very successful career outside clinical medicine. So I start with this view. So this is actually the view from my apartment in New York City. So I lived in Manhattan for 2 years, in 2015 to 2017. My apartment is actually very near to Times Square. I can just walk to Times Square within 10 minutes. So how did I get there? How did I went to school, Sekolah Rendah Kebangsaan Batu Empat Jalan Ipoh. So it's still there, very old. How did I get to work in Manhattan? So basically after school, I went to MRSM trained up. My dad was in the army. And then after that, I went to England. I studied in Newcastle University. I graduated in 1997. I don't know how old you are then. I think 2, 3, 4, maybe some even not born yet, I don't know. And after graduating, I then decided to do renal medicine. So I know, I love renal medicine, which is, I know you all think really weird, but for me, renal medicine was quite easy, straightforward, and that's what I did. But after working for a while as a specialist registrar, I decided to leave clinical medicine. I was actually bored. Yeah, I was bored with my work because every day is 80% of the cases are the same. And I was also bored of the hospital system, too much red tapes. And then I was also really struggling with the life and death stuff. So I don't like that. I have to make the decision, when do I stop cardiac arrest when it happens? So therefore I decided to leave. I was looking around what to do. And my friend moved into pharmaceutical medicine already, and she thought this is what I might enjoy. And that's what I did. I moved into pharmaceutical medicine. So my first advice today is talk to people who have moved to the different industry. So today you have many doctors from different walks of life now, and basically found out exactly what are those jobs, what exactly is the job spec, what is their day-to-day working, and then figure out, does it fit your skill? So if you are a people person, you might want a job that lots of people. But if you don't like meeting people, you might want to find a job that sit behind the desk. So find something that fit your skill and then fit what you love to do, because it will make it so much more fun when you're doing something that you love. My first company was called IVEX Pharmaceutical. It's a small generic company. And then I moved to a company called Roche, Charing Plough, and then Merck Sharp and Dome before I ended up in Boehringer Ingelheim. So my first job was actually working on the team that launched dabigatran, the first new oral anticoagulant to hit the market. And I cannot describe the feeling of, wow, I am part of clinical medicine history. I am launching a product that will change clinical medicine. Those of you who are practicing now, you're probably just using it as a daily drug. Don't even think about warfarin anymore. But at that time, it was a really landmark moment where we are changing the clinical medicine, and I was part of that. And that no one can take away from me, actually, that feel of achievement. So with BI, I worked in Germany for 4 years, and then I got a chance to move to the US, hence my apartment in Manhattan. And then after that, forgot to switch my slide, my renal medicine, and then also my pharmaceutical industry there. And basically, I moved then to Malaysia 5 years ago. And I moved back to Malaysia because mainly for my mom. My mom was getting sick and getting old, and she actually died just a few months ago from end-stage renal disease, and she also unfortunately had breast cancer. So, you know, people look at my career and think that, oh, it's... So people think and look at my career and think I move fast and furious. Actually, for me, I think it's quite steady. I move every 2 years. I got a new job, or I got promoted. And people ask me also, what's my secret? How can I do that every 2 years? And sad to say, there is no secret. It boils down to back to hard work. You have to really work hard wherever you go. There's no secret to that. So my advice is when you move job, the first year, you really have to make your mark. And in Malay, we say, kena pulun, yeah? So you have to really put your head down and really establish yourself. Because if you don't meet your KPI, you don't meet your objective, no one will look past that. So your chance of promotion and all that, zero, yeah? But once you get that, the second thing most important is about network. You need to learn how to network. How do you get to know the people in your company and also outside companies, so within your industries? You have to know who are the influential ones, who makes the decision about promotion and all that. And these are all soft skills that no one ever taught us actually, but you need to learn how to do that, how to make small talk, how to make a good first impression, because all this matters. People remember you by how you present yourself to them. And today is, again, fantastic opportunity for you to network. There's so many doctors here, there are so many different industries here, and I urge you to come and talk to everybody and make sure that they remember you somehow. So network today, yeah? So if you haven't networked with me yet, then this is the QR code for my LinkedIn profile. You can take your phone out now to make a link to me, and later on also come and talk to me more about it. I also have my team for Boehringer Ingelheim here. We don't actually have a signboard, but the team is called Angels. So Angels are the team who work on improving the stroke care in Malaysia. So they are out there. So come and talk to me, come and talk to my team more about what does pharmaceutical industry do and what we can offer to you. So once you've done all that, you've talked to a lot of people, you might ask me then, how do I know this job is the perfect one for me? The answer again, you will never know. And my advice now is basically to be courageous. When you're already thinking about switching your career, just do it. Stop thinking, stop overthinking, stop overanalyzing about it. So changing job, I admit, is a scary thing. Yeah? So it's one of the top 3 most stressful events in your life. The other 2, getting married, moving house. So don't do all 3 at once. You go crazy, yeah? So basically, but when you're ready to, when you are thinking about changing your career, just do it. Because no one else will tell you that this is the right time. So when I left clinical medicine to join pharmaceutical industry, most of my friends said, why are you changing now? Yeah, just wait. You only have another 1.5 years to become a consultant. But I really cannot tahan anymore, so I left. So I just did it and I left. When I moved to Germany, I had no friends. I don't know anyone in Germany. I don't speak German at all at that time. But now ich kann ein bisschen Deutsch. So no, I just did it. Yeah, just took the plunge and I moved to Germany. So there you go. It is possible to have a better career outside clinical medicine. Not doing clinical medicine isn't the end of your doctorate life. So to summarize, what I want to say is basically, right now is your chance to take charge of your own career. I say be your own CEO, be your own Sendirian Berhad. So you are now in charge of yourself. But when you're looking for a job, make sure that you find something that you love to do, and then make sure you don't forget about networking. It opens so much more opportunity that you doesn't even know exists before. And then when you're thinking about changing career, be courageous and take the plunge. Okay, so thank you very much for today. I hope to see a lot of you later on talking to me. Okay, bye-bye, thanks.
Thank you.